Hi everyone, this is just a quick video to introduce you to the Prelim Health Check. Now level 5s do not have to demonstrate the Prelim Health Check, they just have to know how to do it and be able to identify the areas of the dog they need to check. We also want to practice saying words that describe what we see rather than diagnostic terms. So first of all you need to do a distance exam. Basically, is the dog safe to approach and whether they have any obvious signs of that you would have red flag for a vet. So first one is there's no bleeding wounds. You probably want to get the dog to walk. I won't be doing that right now because he's sitting so nicely. But you'll assess whether he's safe to approach. He's attending to something off to his left, but his ears are not flat against his head. His tail's quite relaxed, just lack of a better word. And he's attending to me. Tyson, good dog, okay? So a fearful or an aggressive dog won't attend to you. First of all, we're going to... an owner would always be holding the dog, so this is a little bit confounded. But when you approach a dog you don't know, there's a couple of things you need to remember. You have to be on the side, down low, hand under the chin, and keep talking to the dog. Hi Titan, keep talking to the dog, okay? Most dogs that we come in contact with during Prelim Health Check will actually come to you. But you still have to demonstrate that you know how to approach a dog you don't know. Okay? So the first thing we're going to do, get down low with the dog. Okay? And we're going to look at the face. So the first thing is it's his nose. Okay? You comment on what you see. So it's wet, not dry. He's got a slight discoloration on one side of his nose. He's got quite a white muzzle, but there's no discharge and there's no redness or gashes or anything like that, okay? Next thing would be the eyes. So you gently pull down. It's red where it should be red and white where it should be white. Again, no discharge or sleep there. There's no dirt, there's no foreign objects in his eyes. And because there are two, you check both. Next you do the ears. So the ears, you're looking for dirt. Are they clean? Is there foreign objects in there? And of course the smell. Now some people tell you that you have to get right up close. You don't. When you enter a room and a dog's got an ear issue, you are going to smell it. And the second thing is, if it's a dog you don't know, you definitely don't want to put your face right near the sharp bits. Okay? So again, 2 ears, check both. Now at level 5 we talk about the teeth. We don't actually check them because it's too traumatic for the dog. Okay, but you're going to talk about things like the colour of the teeth. Are any missing? Are there any foreign objects in the mouth or in the teeth? Okay, you're going to talk about the tongue. What colour is it? Is it all there? Mucous membranes or the gums, what colour are they? Are they intact? Is there any irritation there? And you talk about the capillary refill time. Now that indicates circulation. You put your thumb on the gum, push down gently and then release. The colour will go white and then come back pink within 2 seconds hopefully. Now some dogs have a pigment that makes the circulation quite hard to measure using that method. Okay. Now once you've talked about the mouth, we're going to move down the dog. So using 2 hands, we do this because if you feel something on one side of the dog and not the other, you might be able to flag it for the vet or look a bit closer. Now Tyson's actually recently had a big lump removed, so he does feel different on the left and right side. Using both hands, try and spread your fingers, cover as much surface area as you can and go down the dog, okay? Now it looks like I'm getting really close to the dog. I am. So you'd only do this if you were 100% certain this dog was safe. Okay, now once you get down to the feet, you can check. Okay, now students typically rush this area and it's because the dog usually reacts. Now you check in between the pads. On the pads, Tyson has a little bit of redness and almost a missing patch of pad, but he doesn't seem to be too worried about me touching it today. But you check, look at the claw length, they're a bit long, but because he's got black claws it's hard to trim without accidentally getting a cuticle. You'd also talk about the fact he's got rough elbows. So this might indicate that he sleeps on rough ground, but in actual fact he has a really comfy bed. He just chooses to sleep on rock. You do both feet obviously. Sometimes you're not actually looking for discharge or irritation or redness, you're looking for the reaction of the dog. So if it moves in reaction to something you push, that could indicate pain or something's a little bit swollen or sore, so you'd flag it for the vet. So we'll continue on down, or just abdomen, okay? Big hands. Students typically rush this part and miss things. Tyson had a very large lump on his side, and students would regularly miss that because they were rushing. When you get to the spine, you go a bit slower, 2 hands on either side, and you're actually looking for a reaction rather than lumps and bumps this time, and go all the way down to the tail. Okay? Tyson's old hat at this. So I think he's just tolerating me. Okay, can you stand up? Stand up. Oh, what a good dog. What a good dog. Okay, so we're going to go under here as well. Make sure you check those armpits because you might find a bump in there, which I just did, so that's cool. Right, and down the legs, same again with the back legs. And at the same time, while you're down this end, you can check the anus. You're looking for anything swollen or funny discharge, funny smell. He's not a long-haired dog, but long-haired dogs get dags, so you can comment on that. Clean, and he's letting you check it. Check underneath. You could get the dog to roll over, but it's just easier for you to move. There doesn't seem to be any issues here. There are no skin issues. It's clean. There's no discharge. He's a boy because he has a penis, and he's fixed because he doesn't have testicles. Use the correct terms. Okay, last 2 things to look at. Because he's a short-haired dog, it'd take forever to spot check his skin. So you can just move like this up his back. You're looking for, in terms of skin, any dryness or irritation, and in terms of his coat, any flea dander, any dirt, or mattedness, that kind of thing. Final thing is your hydration check. Handful, and let it go. Okay, if it's quite quick to spring back, that means your dog's probably adequately hydrated. Okay, so top 2 things to remember: describe what you see and use words that cover things like irritation and redness and discharge, rather than, oh, he has a sore foot. Okay, cool, thank you.